Good morning. It's an absolute pleasure to speak with you today. And what I'd like you to do first and foremost is know everyone in this room, each one of you is beautiful. Beautiful in the heart, beautiful in the soul, beautiful in the mind, and beautiful exterior. Beauty is individual and very unique, and each one of us grasp our own individual beauty. I want you to do one thing for me. Look at your neighbor and say, "Good morning, you're beautiful." Come on. Good morning, you're beautiful. That's great. Doesn't that make you feel better, huh? Big smile. Thank you. Today we're going to talk about facial rejuvenation. And with facial rejuvenation, what we can do is help our skin, our DNA, the way we were made, to last the longest that it can, and to actually do some things to turn back time. In our clinic, we're known for, if you give me 10 minutes, I'll give you 10 years. Phenomenal things can be done in 10 minutes to rejuvenate, revolumize, and just give a little tweak to the skin. As we all know, one of these famous icons, Elizabeth Taylor, she was born with beautiful fullness in the cheeks, in the upper face, in the lips. And it's this volume that carried that icon beauty throughout time. Even as an older, more mature version of herself, she still looks beautiful. And it's from the volume in the cheeks, in the lips, in the forehead, and in the upper eyes. Dr. Marquette developed the mathematics of beauty. And it's related to pi. You may remember pi from science back in high school. Pi being 1.6 in this instance. And what these mathematical geniuses decided was 1.6, the ratio of 1.6 between the nose and the upper lip, between the nose and either eye, and different areas of the face are what determine beauty. So whether we take Angelina Jolie and put this mathematical parameters on her face or any other icon, including Cleopatra, those 1.6 ratios are clear against any ethnic beauty and determine the perfect face. So when we touch with a little bit of filler and a little bit of BOTOX, we can mimic most people to come close or assimilate that 1.6 to 1.6 to 1.6 ratio amongst the face. Leonardo da Vinci was actually onto this way back in the day. There are many different muscles of the face. There are circular ones around the eye, vertical ones in the forehead, tangential ones across the cheek to the mouth, circular around the mouth. When we address these muscles with a little bit of BOTOX or filler, we can accentuate and make a very, very volumized and beautiful presence. The effects of environment and aging on the face: we lose volume, we get wrinkling around the mouth, canals form between the nose and the outer corners of the mouth, dimpling of the skin, wrinkling across the forehead, around the eyes, and in the glabella area between the eyes. When we're all looking for that fountain of youth, what we have found is that the DNA helps us to determine what we can do to fight the aging process for each individual person. Some people may have a decreased elasticity and start with more of a sag. Some people may have a fat imbalance and they start gaining fat where they don't want it and losing it where they do. One of the things that determines age in the face is when we start to lose that three-dimensional plump in the cheeks, center cheeks, outer cheeks, and when the marionette or puppet lines form between the mouth and the chin. The skin DNA research thus far, we take a simple swab and we swab your mouth. We send the DNA collection off, and what comes back is some very interesting data. Firmness and elasticity genes, that'll tell us how you're holding up there. You may be very strong on that genetic component, or you may be moderate or even weak. Once we know that, we know what to do for that major gene number 1. Gene set number 2, wrinkling and glycation genes. Glycation is a fancy word for sugar. We all know if we eat a lot of sugar, we'll do things like gain weight and maybe get diabetes. But did we know if we eat a lot of sugar and we have a good sugar gene, no problem for the face. But if we eat a lot of sugar in its various forms, whether it's a Coca-Cola, a donut, or pasta, potatoes, or even a glass of wine, if we do not have a strong glycation or sugar gene, we're going to wrinkle the skin faster. So we need to know the answers to this, to know which set of parameters is going to age our skin more quickly. Third set of genes, sun damage and the pigmentation gene. If you're strong in that gene, you can get that beautiful golden tan. If you're weak in that gene, you're going to be typically of a lighter skin color. You can still be more golden, but you will freckle and you will form age spots more quickly and get some of that melasmal or brown spotting, also red spots around the face. This is due to a weakness in the gene that codes for different forms of melanin pigment. Our fourth major set of genes is free radical damage. Again, some of us internally with inflammation, cortisol, some of those words you may have heard before, we get them from things like xenogens. Xenogens or fake estrogens that are sort of passed on to us. The steroid and the antibiotics go to the cow goes to the market, we get the beautiful filet mignon steaks, but they've got the xenoestrogens from the hormones originally fed to them, and then we're ingesting it. Causes inflammation and breakdown, especially if we've got weaker free radical genes. If we've got stronger ones, we can metabolize that, throw it out, and not let us affect our skin as readily. In addition to that, of course, the free radicals are internally doing different aging and inflammation factors, but that's another talk for another day. Sensitivity and inflammation genes. Some of you may notice that as you've gotten older, your skin may get redder more quickly or form a little rash more frequently. That's because as you're aging, if you've got the weaker sensitivity and inflammation genes, things that never affected you before, whether it's a soap or whether it's a new lotion or cream or moisturizer, you can have effects with some of the active or inactive ingredients, colorations or gel-based carries and so on and so forth. As a side note, when you're shopping for a moisturizer should be clear, should be see-through, could be tinted, but you should absolutely be able to see through it. Maybe the color of virgin olive oil or clear, depending on what constituents that moisturizer is made of. If it's opaque white or yellowy, then that's very good for the cosmetic manufacturer because that would preserve the lotion or moisturizer for 3 to 5 years and keep it on the shelf longer. But that's absolutely not good for your skin. So make sure when you're shopping for a moisturizer, shop for one that's clear. So besides identifying what are my weaker genes and what are my stronger genes, what can we do with this information? Once we find out your genetic parameters, and then we put that together, we then can go to topically. You've all heard of, there's resveratrol, coenzyme Q10, stem cells, vitamin C, retin A, hydroxyquinone, hyaluronic acid, kojic acid, all these wonderful different serums. Well, can I put 100 different serums on my face tonight? No, I can't. Which 5 or 6 or 3 or 4 should I put on my face? Well, we're going to look at your genes. And if you're weak in glycation, we're going to send you to resveratrol plus 2 or 3 others. If you're weak in the sensitivity and inflammation, we're going to put a ubiquinol coenzyme Q10 toner, so on and so forth. So we're going to hand pick from all the variety that's out there, whichever set of these new and wonderful things are good for your set of genes. It just doesn't stop topically though. Once we detect, for example, that you have lower free radical genes, it's going to be important for us to put a protective topical, but also to get you to use a very strong medical grade ubiquinol coenzyme Q10 supplement, for example. Vitamin C powder, oxidized, buffered, for example, if that were one of your weak components. Again, with supplements, we, on the medical side of the house, we look through everyone's vitamin potential, food allergies, see where someone may be deficient in what certain areas of vitamins, minerals, and amino acids. And when we identify that, then we're going to pick that group of supplements customized to that client, because there are over 100 or more different supplements, and they're all good, but they're not all good for you. You need to know which ones you need to supplement for yourself. Of course, there are a few general ones like, for example, high omegas, which in layman's terms, fish oil, but it's got to have what? The high EPA and high DHA, or you're just swallowing motor oil. Taken, for example, that you're swallowing a good one, the ones with the high EPA and DHA, over 400 to 600, then that's good for everyone in so many different ways, for the brain, for the cholesterol, for anti-inflammation, so on and so forth. And finally, we take those customized DNA panels to let you know which procedures are the right procedure for you. So, for example, should you pick a deep laser, a light laser, a heat laser, a cold laser, a chemical peel, microdermabrasion, radiofrequency laser, BBL, broadband light? It depends on the way your DNA is built, so that you're spending your money and getting the type of procedure that matches the type of deficiencies or potential deficiencies in your skin. For example, the work done by Dr. Patrick Bitter, a dear friend of mine in Los Gatos, California, he did a study, Forever Young. It's published at Stanford University. And what he proved is with IPL, intense pulse light, sometimes called IPL laser, and now the more up-to-date version, BBL, broadband light, he and Dr. Jason Posner did a study, and on that study they proved that all the ladies that have kept up with IPL, intense pulse light laser, or BBL, broadband light laser, over the years, instead of their collagen bundles falling over the years as it does and getting very, very thin and frail, their collagen bundles were kept intact at a 29, 39-year level, or whenever they started the intense pulse light. And then the ladies who started them later in life, they showed a rebuilding by biopsy. So it's phenomenal proof that light lasers and anti-aging treatments really do work. So, excuse me, I think I got ahead of myself there. So with facial rejuvenation, we can relax the wrinkles with BOTOX that are already there, soften them. BOTOX, if you go to a BOTOX class and then you go home and you inject on Monday, what winds up happening is you get people that look like deer with headlights, right? Frozen face. We don't want a frozen face. However, if someone has some wrinkling and wants to just soften the face and soften the wrinkling and have a more natural look, that absolutely can be done in a very scientific and artistic way. Fill the lines. So if some nasolabial folds, nose to mouth or mouth to chin, have formed, or you've lost some volume in the cheeks that need to be replaced, you can use some facial fillers, totally safe, made out of calcium or hyaluronic acid, proteins, two substances very, very familiar to the body, can be replaced and look very beautiful. So we restore the volume, we rebuild the cells. We rebuild the cells with light lasers. We also can rebuild the cells with PRP. PRP is platelet-rich protein plasma. PRP is a very, very simple technique. We take a little bit of their blood and we spin it down in a very special centrifuge that protects the platelet stem cells and growth factors. We throw away the bloody component, but we keep those delicious stem cells. Many of you in this room know Drew Brees, NFL player, football. And platelet-rich plasma is what saved him from surgery in his last season when he injured that shoulder. So instead of doing surgery, they took platelet-rich plasma, the stem cells and growth factors from his own blood donation, and they re-injected that back into his shoulder. What stem cells and growth factors do is they make a decision. Where they're placed is what they form, because they're baby cells, and they land there and say, oh, you want me to rebuild shoulder ligaments, tendons, and elastic fibers? I can do that. If you re-inject it to the face, it's, oh, you want me to rebuild collagen, elastin, fibrin, and make new beautiful skin cells? Okay, I can do that. Platelet-rich plasma is used all over the body for not only beauty and aesthetics, but also for things like rebuilding a shoulder. Tiger Woods also had the injection done in some of his injuries, as well as many other sports players. In the endodontic work, gums and teeth, they use it to inject into the gums before they put in new teeth implants. And that way, that implant, they know they're putting back into new and revitalized tissue, and it has a better chance of forming and holding. So we discussed fillers to refill the volume, BOTOX to smooth out the wrinkles, and lips as dermal fillers, because after a certain age, if we're someone that's very talkative and animated facially, or we use a lot of straws, or maybe if we smoke, those lips will sink down like a raisin because they've lost volume. And you put the volume back in a very gentle manner, because we don't want anybody quacking. No ducks, please. BOTOX, nature's wrinkle relaxer, prevents wrinkle progression. It absolutely anti-ages the face and absolutely will stop wrinkle formation and back up wrinkle damage. Quick and no downtime, and it's pretty long lasting. Facial fillers used for lips, volumes, wrinkles, and folds. Platelet-rich plasma, used to stimulate your own growth, will fill in scars, and can be used in other areas of the body. It is used down below the waist for urinary frequency or leakage, erectile dysfunctions, and many other sexual issues as well. I discussed a little bit about BBL, IPL, and then if you're genetic displayed that you needed some deeper lasers, there's also Q-switch, radiofrequency, and CO2 lasers. I did want to show you. Kim Kardashian had the vampire rejuvenation technique on television. I don't know if anyone saw that. They over-dramatize it a bit, because the red portion you really do throw away most of that. You're keeping the stem cells, and that's what you're re-injecting. But that is the procedure that I've been discussing, which is platelet-rich protein that they pulled out the vampire as sort of a funny cliche on it to get their point across. So that's sort of a whirlwind tour through facial rejuvenation and the things that we can do that are new and different to sort of help slow down the aging process and let us all age gracefully. Thank you so much for your time. It's been an absolute pleasure speaking with you this morning.